Guys, it's Pam, your dental hygienist of 21 years. I work in a general practice. Today I want to talk about informed consent and telling patients all of the possibilities for the health of their teeth and replacement. So this guy, we're going to talk about this root canal. This was done by a general dentist about 15 years ago. In our practice, we do take x-rays periapicals of the teeth, but not yearly, so things like this can crop up without us knowing. This was actually discussed with the patient to do as a retreat. You can see the infection all along here. I advised the patient that a retreatment would cost a lot of money, probably would have a very poor success rate because the tooth has been dead for so long, the roots are very brittle, so he could spend a lot of money and end up losing the tooth anyway. He and the dentist discussed it, and he decided to do the retreatment per the suggestion of the dentist. So 6 months later, he called the office, and I had answered the phone that day because our office manager was out, and he said he was having horrible swelling in his mouth, and I said, let me guess, it's your lower right. He said, how did you know? Obviously, I wasn't advocating retreatment because this was the retreated tooth. So this is about 6 months later, and you can see the massive amount of infection. They actually went through the bottom of the root, called an apico, to re-clean out the canals and seal them up. But this was a failure, and he ended up with massive swelling, a huge fistula, and it's damaged the bone here. So he was really sorry that he didn't initially extract it and do the implant. He did extract it and do the implant, but he wasted a lot of money and time and ended up in a lot of pain. So he was put on an antibiotic, and then an oral surgeon removed this tooth. He now has a very successful implant, and this is just why telling a patient things that can happen so they can make an informed decision is important. When a dentist tells them what they think they should do instead of giving them all the options, it can lead to wasted time and money down the road. Thanks, subscribe, take care.